Let's begin with our lecture, Laryngeal Paralysis and Trauma. And in the first section now, we will discuss mainly the effect of the superior laryngeal nerve paralysis. We will talk about the effects of superior laryngeal paralysis on the larynx, and then we will also discuss the nerve supply of the larynx. What are the different branches of the different nerves that supply the larynx? What are the causes of laryngeal paralysis? And then also if the paralysis is the unilateral on one side or on both sides of the larynx as a result of the recurrent superior laryngeal nerve paralysis in the first section. Then in the second section, we will move on to the recurrent laryngeal nerve paralysis. So first, we will just focus on the superior laryngeal nerve paralysis. So nerve supply of the larynx, it's simple. The two main nerves that supply the larynx are the superior laryngeal nerve, which is both on the right side and the left side. And then we have recurrent laryngeal nerve, similarly on the right and the left side. So a paralysis of these nerves can lead to unilateral or bilateral, because if you see now, they are on the right side and on the left side. So whatever side is affected will lead to the paralysis of that side. So superior laryngeal and recurrent laryngeal nerves are the main nerves that supply the larynx. Motor is recurrent laryngeal nerve, so the motor function of the larynx are controlled by the recurrent laryngeal nerve. That's the recurrent laryngeal nerve. The cricothyroid muscle supplied by the external laryngeal nerve. So the motor function are carried out by the recurrent laryngeal nerve, and the muscle which is supplied by is the cricothyroid muscle, and this is supplied by the external laryngeal nerve. These have external and internal branches. So cricothyroid muscle is by the external laryngeal nerve. Sensory function is above the vocal cords, internal laryngeal nerve. So the external laryngeal nerve is mainly responsible for the motor function, and it supplies the cricothyroid muscle, whereas the sensory function is by the internal laryngeal nerve. Below vocal cords, it's recurrent laryngeal nerve. So again, sensory functions are divided into above the vocal cords and below the vocal cords. Nerve supply is different above the vocal cords and below the vocal cords. Above the vocal cords, it's internal laryngeal nerve. Below the vocal cords, it's recurrent laryngeal nerve. Then the recurrent laryngeal nerve from vagus at level of subclavian artery. Left one arises from vagus in mediastinum. So the recurrent laryngeal nerve, that's the recurrent laryngeal nerve. It arises from the vagus nerve at the level of subclavian artery, and the left one, this is the left recurrent laryngeal nerve. It arises from the vagus in the mediastinum. Mediastinum is the thoracic region, so left one arises in the mediastinum, little lower. The longer course of left laryngeal nerve is prone to paralysis. So left recurrent laryngeal nerve it has a longer course. If you see, it arises from the vagus in the mediastinum, and because of this long course, it is more prone to paralysis as a result of different etiological factors which we will discuss later on. So the left recurrent laryngeal nerve is longer as compared to right recurrent laryngeal nerve. Then superior laryngeal nerve from inferior ganglion of the vagus, external and internal branches, and they have external supplies the cricothyroid muscle. Here we already went over the external and internal branches of recurrent laryngeal nerve, and the external supplies the cricothyroid muscle, mainly responsible for the motor function of the larynx. And then we have internal laryngeal, which is below the vocal cord, and it's mainly for the sensory function of the larynx. So above vocal cords, internal laryngeal nerve, and below vocal cord is recurrent laryngeal nerve. So superior laryngeal nerve, it has internal and external branches. It arises from the inferior ganglion of the vagus nerve. So if you see, all these nerves are arising from the vagus, but the site at which they originate is different. Some in the mediastinum and some from inferior ganglion of the vagus. Again, we have the motor function, which is by the recurrent laryngeal nerve, external and external branch, which supplies the cricothyroid muscle. Sensory is by the internal branch of the recurrent laryngeal nerve, and also by the recurrent laryngeal nerve itself. So all this is the nerve supply of the larynx. But the main thing is, make sure you excuse me, you should know that the main nerve supply is coming from the recurrent laryngeal nerve and the superior laryngeal nerve, which is in the right side and the left side. And the left recurrent laryngeal nerve has a long course, so this is more prone to paralysis. The internal branch supplies larynx and hypopharynx. So this is all about the superior laryngeal nerve, which is divided into the internal and external branches. External branch supplies the cricothyroid muscle. Internal branch supplies the larynx and the hypopharynx. So very, very good description of all the nerve supply associated with the larynx. Now the classification of laryngeal paralysis. It can be unilateral or bilateral. We already saw they are on the both sides. If one side is affected, then it can be unilateral. If both, bilateral. Here you can see this is the paralyzed right vocal cord and the paralyzed left vocal cord. Classification of paralysis. We have paralysis due to recurrent laryngeal nerve, superior laryngeal nerve, or combined, which involve both the superior and recurrent laryngeal nerves. So it can be both because of superior laryngeal nerve, recurrent laryngeal nerve, and when both nerves are involved, it can cause combined paralysis. Again, causes of laryngeal paralysis or etiology. We have supranuclear causes, which are rare. So supranuclear paralysis of the larynx is rare. Nuclear causes, we have involvement of nucleus ambiguus in medulla. Causes are variable, like vascular causes, neoplastic, polio, syringobulbia, associated paralysis of other cranial nerves. So the nuclear causes can be because of the vascular causes, neoplastic, polio, syringobulbia, and associated paralysis of other cranial nerves. High vagal lesions, we have involvement of vagal nerve in skull, exit from jugular foramen and in parapharyngeal space. So these are the causes of laryngeal paralysis. We have supranuclear, which are rare above the nucleus, then nuclear causes, which can be due to vascular, neoplastic, polio. All these can cause the nuclear causes of laryngeal paralysis. Then high vagal lesions, involvement of vagal nerve in the skull because it's high, which exit from jugular foramen and in parapharyngeal space. So these are the sites of involvement of the vagal nerve at the different sites, can be in the parapharyngeal space or in the at the time when it exits from the jugular foramen. So all these are the causes of the laryngeal paralysis. Some other causes, we have low vagal or recurrent laryngeal nerve involvement. Systemic causes are diabetes, syphilis, diphtheria, typhoid, streptococcal or viral infections, lead poisoning. Idiopathic causes are the causes in which the cause is not known, is in about 30% of the cases, and cause remain obscure. Sometimes, lot of the times, even I saw some patient remember the cases when no cause is noticed, they have problem in the larynx and the voice is lost, and over a period of time, over months and years, usually it comes back. So idiopathic causes are quite a few in 30% of the cases. No cause of paralysis is found. Then we have some systemic diseases like diphtheria, typhoid, diabetes, syphilis, streptococcal or viral infections, and lead poisoning, all that can lead to the laryngeal paralysis. Paralysis of superior laryngeal nerve, if it's unilateral on one side, this is the superior laryngeal nerve, that's the internal branch and that's the external branch. This is an external branch. We said it supplies cricothyroid muscle, and then we have the internal branch that supplies the larynx and the hypopharynx. This is the superior laryngeal nerve. So unilateral paralysis of superior laryngeal nerve is isolated lesions of this nerve are rare. Part of combined paralysis. It means the superior laryngeal nerve is not very commonly involved all alone. It is involved as a part of combined paralysis when it is associated with recurrent laryngeal nerve paralysis. Paralysis cause paralysis of cricothyroid muscle. We already mentioned the external branch supplies the cricothyroid muscle that naturally gets paralyzed. Ipsilateral anesthesia of the larynx above the cord. No, there is paralysis, though, so no sensations in the larynx. So there is anesthesia, loss of sensation. Paralysis of cricothyroid due to external laryngeal nerve involvement in thyroid surgery, tumors, neuritis, or diphtheria. All these are the causes of paralysis of superior laryngeal nerve. So in thyroid surgery, tumors, neuritis, or diphtheria, these are all the causes that can cause unilateral paralysis of superior laryngeal nerve. Again, not very common, usually as a part of the combined paralysis when when both superior and recurrent are involved. And then we already mentioned superior laryngeal nerve has external branch and internal, and most of the features here will be associated with the external division paralysis leading to the paralysis or weakness of the cricothyroid muscle. Clinical features are voice is weak and pitch cannot be raised. Anesthesia of larynx on one side, askew position of the glottis, not in the middle, its position askew is called askew position of glottis. Shortening of cord with loss of tension. Flapping of cord. So all these different clinical features are present because of the paralysis of the superior laryngeal nerve, mainly the external division of superior laryngeal nerve, which is associated with the weak voice, pitch is not raised, and the muscle is lost. So mostly the positioning is not very well aligned. There is askew position of the glottis, shortening of the cord with loss of tension, and flapping of cord. Diagnosis by electromyography of cricothyroid muscles. Now, paralysis of superior laryngeal nerve, bilateral paralysis of superior. Now you can see it's paralyzed right cord, paralyzed left because it's both sides are infected. This is an uncommon condition. Both the cricothyroid muscles are paralyzed along with anesthesia of upper larynx. We mentioned that the superior laryngeal nerve external branch supplies the cricothyroid muscle. The internal branch supplies the larynx. So there will be involvement of the upper part of the larynx, which leads to the anesthesia, loss of sensation. But again, it's uncommon condition. Causes are surgical or accidental trauma, neuritis, mostly diphtheretic neuritis, pressure by cervical nodes, involvement in neoplastic process. Clinical features now bilateral. We have paralysis, bilateral anesthesia, inhalation of food, pharyngeal secretions, cough and choking fits, voice weak and husky. So all these are the features associated with bilateral paralysis of the recurrent superior laryngeal nerve. We have paralysis, bilateral anesthesia, loss of sensations. The inhalation of food will occur with this because there is no sensation and no awareness. Pharyngeal secretions, there is cough associated and choking fits are present. And there is voice which is weak and husky. So these are the features associated with bilateral paralysis. Treatment now depends on the cause and how severe are the symptoms associated with this. Spontaneous recovery can occur if the cause is neuritis. Repeated aspiration, tracheostomy with the cuff tube, esophageal feeding tube, epiglottopexy, which is reversible. So all these are the treatment options for the paralysis depending on the cause. Usually spontaneous recovery occur if the cause is neuritis. Tracheostomy can be done. Esophageal feeding tube because of loss of sensation and anesthesia. There is aspiration of food that's dangerous, so tube feeding is done, and then epiglottopexy, which is reversible. So that was all about the section 1. Thank you for watching sqadia.com.